Why does my tooth need a root canal if it doesn't even hurt? Well, Mr. Jones, just because that tooth isn't hurting doesn't mean there's nothing wrong with it. I've looked at your radiographs and clearly there's an infection going on. The reason you don't have any pain is because the tooth is already dead, and so your nerves are dying and it's not sending that pain response to your brain. The inflammation that you do have there is draining out, it's not causing any pain, but we do need to do a root canal in order to clean that out, clean the necrotic dead tissue out, medicate it, and then try to fight the infection that is going on right now. Now I was wondering, why does my molar need a crown after I've had a root canal? Shouldn't that take care of it? Main reason you need a crown after you have a root canal done is that it's in order to protect the tooth. The tooth is really brittle after having a root canal, and so we want to have that crown on there just to prevent future fractures. Okay. Now you say I have a lot of these caries. Why does my tooth need a crown and not just a normal restoration? The reason you need a crown for the carious tooth is that the caries are so large that in order to remove all the caries, we'd have to we'd only be leaving a very small amount of tooth structure there. So, the tooth would be very susceptible to fracture when chewing on it, just because the outside of the tooth is just basically a shell. So we just want to remove that and then put a solid crown on there so you can chew comfortably and it's not going to damage the tooth any further. Why does this exam take so long? It takes so long, your appointments, because we're an educational institute here at Loma Linda, and we like to go through all your possible options and select the best treatment for you. And sometimes that takes a little bit longer. We're students, so we're new to doing the whole dental thing, but we just want to make sure we give the best treatment to you that we can. Why does it take so long to make my dentures? Oh, hey, Britta. Hey, Dr. Tan. Yeah. The reason, Mr. Jones, that it takes so long for your dentures to be completed and placed in is that we have to wait for the bone levels and the gingiva to finish healing, because if we place the dentures before that's all done, we can, the denture might not fit later on when those levels change, and we want to make sure it fits comfortably and well, because you don't want your dentures falling out and embarrassing the public scene, and we want to make sure you can chew as well as you possibly can with those dentures. Why do we need to make another impression of that crown prep? Mr. Jones, the reason we need to take another impression of that crown preparation is that we need to make sure we get the complete margins on the impression. We don't want to have any voids or mistakes or irregularities on it, just because when we use those impressions to make the crown, and if the impressions are off, the crown's going to be off. And if we have any open margins, bacteria can get underneath that crown and your tooth won't last near as long as if we had good sealed margins. So that's why. Oh, movie star.